I'm Dr. Julia Morahan, Head of Research at MS Australia. Last week, I had the pleasure to attend ECTRIMS for 2021, the 37th Congress of the European Committee for Treatment and Research in MS, which is the largest conference in the world for MS research. Due to the ongoing COVID-19 pandemic, ECTRIMS 2021 was held virtually and was attended by over 9,000 delegates from over 100 countries. Day one included a wonderful opening address from Professor Roland Martin from the University of Zurich in Switzerland. Professor Martin spoke about gains through translational research in MS, from fundamental neuroimmunological research through to disease-modifying therapies. He spoke about the momentum that has happened over the last 20 years, our increasing understanding of what is happening in the brain and spinal cord of people with MS, and how the immune system attacks the brain and spinal cord. His research that allowed for deep characterization of the immune cell dysregulation in MS, and the changes that we see within the brains of people with MS. He spoke about how all of this knowledge was used to design the current therapies that we have for MS. He covered the long journey from the laboratory models through to the people in clinical trials, and the many hurdles that need to be overcome to have success. Despite this, Professor Martin discussed the great gains we have had in the treatment space for MS, especially for the relapsing forms, through our understanding of the immunology of MS, but also acknowledging the great need for medications that protect the brain from damage and repair damage that has already occurred, which is a great need for those with the progressive forms of the disease. Finally, he discussed some early clinical trials that are ongoing, looking at new ways to teach the immune system to no longer react or attack in MS and to build immune tolerance. Complementary to Professor Martin's presentation on their excellent work using human brains that are affected by MS to understand MS at the coalface and molecular level, Day one also included a presentation by Richard Reynolds on the many types of research that can be carried out using tissue directly affected by MS. One of Australia's national collaborative platforms is a national brain bank, which provides MS-affected tissue and unaffected tissue to researchers around the world to conduct research into MS. COVID-19 was also covered in one of the hot topic sessions on day one. Over the course of the pandemic, we have moved from researching how SARS-CoV-2 might affect people with MS differently or alter the disease course in people with MS, to how treatments might interact with vaccines. The presentations in this session covered a wide number of topics, revealing that while there are neurological complications of COVID infection, there is limited evidence that the virus actually enters the brain. Maria Piersomani from Italy, who has been looking at global data on COVID and MS through registries, showed that risk of hospitalisation was due to factors that were at play in the general population in people with MS. This included factors such as male gender, age, or having other diseases in addition to COVID. Registry data also confirms that those who are on cell-depleting therapies for their MS are more likely to develop severe COVID. Anat Atrium from Israel presented new data on the interactions between MS medications and vaccines for COVID-19. Israel were very quick in their vaccine rollout, so it has been a good population to study to get early indications of how the vaccines and MS medications interact. Since MS medications affect the immune system, it is not surprising that there is a change to the immune response to the COVID-19 vaccines. In particular, she discussed the lowered response to particular classes of MS medications, including the B-cell depleters and the S1P inhibitors, and the role for booster shots in this group of people. Like the rest of the global MS community, MS Australia has been keeping a close eye on this research, and we have developed a COVID hub on the MS Australia website. This information is kept constantly up to date, and I would urge you to check it out if you are seeking further information. Day 1 also included MS Australia's very own Dr. Therese Burke, presenting and chairing a session in the nurses section. Therese presented her research looking at the pivotal role of MS nurses in Australasia in the care of people with MS, and defining the benefit of receiving MS nurse care beyond medication selection. On the clinical trials front, the treatment trials session on day 2 and in the late breaking news on day 3 at ECTRIMS, there were presentations on the results of the phase 3 trial looking at ublituximab versus teriflunomide for relapsing MS. Teriflunomide was originally known as Aubagio in Australia. The new medication, ublituximab, is a glycoengineered anti-CD20 monoclonal antibody. So that puts it in the same class as rituximab, ocrelizumab and ofatumumab. In the clinical trial described, participants were treated across 96 weeks and the primary endpoint was annualized relapse rate. The medication reduced the relapse rate across 2 trials by 49% and 59% respectively. And the MRI data showed a huge 96% reduction in active lesions for those on ublituximab. They also showed 3 to 4 times the number of participants achieving no evidence of disease activity or NIDA in the ublituximab group. Day 3 contained a wonderful session on patient perspectives and in particular the use of patient-reported outcomes in research. This is a truly important topic and one that has been gaining ground over the last few years. Stephen Krieger discussed the importance of capturing what would traditionally be considered subclinical symptoms by examining and listening to people with MS more closely to determine the true impact of the disease rather than the clinically measured impact of the disease. MS Australia has been doing just that with the Australian MS longitudinal study for many years. Running since 2001, the longitudinal study has been capturing patient-reported outcomes from the Australian MS community for 20 years. This information has led to so many insights in areas like employment and medication use, as well as issues that are of importance to Australians living with MS, that allow MS Australia to advocate more effectively to government and other bodies. Results from the Australian MS longitudinal study also featured at ECTRIMS with a poster presentation on a study into the role of MS nurses in Australia. These preliminary results are very interesting and have important implications for the care of people with MS in Australia. We will be launching the full report in April to coincide with the Progress in MS conference held by MS Australia next year. I would also like to congratulate the many other Australian researchers that presented at ECTRIMS this year and faced question times in the middle of the night. They all did an outstanding job. I hope you enjoyed my highlights from ECTRIMS 21 and thank you for watching.